Well, okay, I got interested in transplantation. That's what you want to know.
Yeah.
How I got interested in transplantation. And it actually began the summer I started medical school. I actually had at the University of Minnesota gone around looking for jobs in laboratories, and I found one in the laboratory of Dr. Robert Good, who is a pediatric immunologist, who actually also happened to be chairman of the search committee for Department of Surgery chairman. He had recruited Dr. Najarian and was instrumental in recruiting a strong transplant person. And so that summer of '62, I started working in the immunology laboratory, and it was obvious that transplantation was the place to go. Dr. Najarian would be leading us there, Dr. Good would be leading us there, and Dr. Najarian not quite yet, but he came in '67, and I was there in '62, and Dr. Najarian and Dr. Good was already touting the fact that we would have a strong transplant program. Well, I think observation of the natural history of diseases that we do transplants for. Now, when I was speaking about the fact that I was interested in transplantation from the very beginning, I was interested in immunology. I mean, I started out working with Dr. Good, basic immunology, but of course one area is transplantation immunology, and that's the area that seemed to me to mesh best with surgery. And now if you look at diseases for which you're doing transplants, for example, one example I have of diabetes is diabetes recurs in the transplanted organ, or it can recur if you do a liver transplant, you can have recurrence of the original liver disease. And so I think it's fascinating to look at recurrence of disease and to see what predisposes to that, and it gives you some understanding of the diseases for which we're doing the transplants. Well, I think there is going to be a decrease in the diseases for which we do transplants. We will find other ways to solve them other than transplant, but I don't think that's going to be true for everything that we're doing transplant for now. I think there are many diseases that we do not see the solution short of a transplant, and so I think that even 50 years from now, we will be doing transplants for cirrhosis. I don't think we're going to just solve that like that. And I think it's true for kidney diseases too. There are many kidney diseases right now that occur that we don't have a solution for. You get a kidney disease, the handwriting is on the wall. You're going to have to begin dialysis sometime in the near future unless you can receive a preemptive transplant first, and we indeed do try to do preemptive transplants first, and I think we will continue to do so. Well, I think it's the sense that we are our brother's keeper. We have to volunteer to give our organs, either as a living donor or as a deceased donor, and that requires actually looking at some serious philosophical aspects of life. And so I think our serious philosophers embrace transplantation. Well, that's just about the time where they were beginning to work with tolerance with, Medawar and Billingham, and that it's just about the time where those first articles actually came out showing that you actually could thwart the immune response. And I don't know if that was really so predictable. The fact that you were able to induce tolerance showed then, well, we're still working on it. We still actually have not made tolerance as a routine. If you want a transplant, you have to take anti-rejection drugs, you have to have side effects, and we're still working on it. But indeed, the very first experiments done in the 1960s show that, quote, tolerance is possible. And I think we still work with that assumption that we can actually induce tolerance and maintain normal immune function for our host defense system. Well, again, tolerance is kind of hot, but it's hard to meet its expectation. I mean, we still aren't able to totally do away with immunosuppression and anti-rejection drugs, et cetera, et cetera. I think that the field of generalized immunosuppression has advanced. We have new drugs. We have cyclosporin, we have tacrolimus, et cetera, that have come along, and we embrace these new advances when they occur. But they actually don't get us into a new field. We still have to use generalized immunosuppressive drugs to suppress the rejection response to an organ. And I don't see that actually going away just like that. Well, I think for the intellectual ferment, and I think this is a society in which the intellectual ferment is quite great. If you go to that meeting, you don't have to be locked in anything. You can actually go to cutting edge symposium where anti-rejection treatment is given in a way that you wouldn't have otherwise predicted. So I think that if somebody wants to go into transplantation, they really actually have to join the Transplantation Society, go to the meetings, and hear the innovative work be presented. Carl Groth, I actually nominated him for president. I think he nominated me for president. We both love the society and both wanted to serve it in the capacity of both scientifically and administratively. And I remember nominating Carl for for president, and he had aligned himself on the cutting edge of transplantation immunology research. For example, he'd been a fellow of Dr. Tom Starzl, and he was forever trying to figure out where Tom Starzl was going and where he could go likewise with him. And I think that that he aligned himself with those individuals who felt progressively and who didn't get locked in and say, "Oh no, I'm just going to stay in this area." Carl actually led innovative clinical programs, and I think that he was an example of a president, and he led by example. Well, certainly my wife, Vanessa, who actually is a transplant recipient herself, influenced me, and I have a lot of enthusiasm for transplant because of her. But also Dr. Najarian, Dr. Simmons. I mean, they were my mentors, and I think I saw them promote the areas that they were interested in. They had a flair for doing it, and so I promoted beta cell replacement therapy the best I could, based on their enthusiasm.